A lifetime goal of healthy living. We all want to live a full, long life, and we want that life to be healthy and productive. So how do we make choices today that will improve our tomorrow? Dr. Todd Muncy of Muncy Chiropractic is back with us this morning with some tips for healthy living. And always good to have you here in our studio.
Oh, it's a blessing to be here. I appreciate all you guys do in the community, and I'm just excited to be here each week.
Well, and I love the campaign that you have, the 100-year lifestyle. And so today we're kind of focusing on that 70 plus.
Right. You know, we want to live, well, we don't want to live, we are living longer. It's not a want, it's a fact. People are living much longer than they ever thought they would, but what they didn't think about is, what am I going to do with myself when I get to that age? How do I take care of myself? And that's what we're focusing on a lot with people today, is that you're living in this body for a lifetime. Let's take care of it from the beginning to the end.
And you said genetics certainly will play a role.
Absolutely. Genetics is about 30% of it, okay? And what we got to look at is, we got to look at that 30%. What's the other 70%? Well, that's lifestyle choices. You know, people make choices when they're younger that affect them when they're older. And one of the things I try to teach my patients in my office is, why do you want to make all these bad choices when you're younger and try to amass a sum of income just to give it back to the medical profession when you get older?
Absolutely.
Trying to stay alive.
So you talk about making positive change, and for some, obviously, change is a little difficult, but you say start slow, and before you know it, you have a lifestyle change.
That's right, because one of the founding principles of our office is that, you know, we have 3 life-changing principles. Change is easy. Thinking about change is hard. That's what stalls most people out, thinking about it. They think, well, I want to change, maybe I should go to the gym, maybe I should do this, and they get caught up into thinking about it and saying, oh, this is just too difficult. Well, it's really easy. You just got to make the change. The way you do that is take it in baby steps. You know, we've all heard, how do you eat an elephant? One bite at a time. One bite at a time.
I've heard that, yes, one bite.
One bite at a time, and you take baby steps into change. You take it one step, one breath. And then the third part is adding something healthy to your lifestyle, like chiropractic, to make sure that that nerve system is functioning so that everything else functions the way it should.
Because if your body is not working properly, it doesn't matter what changes you make or how hard you try. If there's something going on internally, and we really need to know that first.
Absolutely. We need to check that and make sure we understand it. And the body talks to us, you know, and what we treat in our office is a thing called subluxation. And if your body's having a problem inside, it will create that subluxation, and we can help find that along the way and work with your medical doctor in conjunction to keep you on a healthier lifestyle.
And I know your office constantly changing and expanding, and you're adding so much, and a lot of these things are ways that you really have kind of taken this on as, this is our mission, and we need to help people get there with all these other things that play a role.
Absolutely. Our mission in our office is to help take care of people for the course of their lifetime. That would be people from 0 to death, and also athletes and anyone in between. We want to make sure that people stay healthy. We've added new things. We've added a nurse practitioner, which we've talked about in previous episodes, but she's adding some new things to help people out. We're doing vitamin infusions now for people. That's IV infusions, natural vitamins that go into our system and help us out. We have things that would help people with skin, hair, and nails. We call that inner beauty. That's something that people can take and infuse, especially women. They're really concerned about how they look as they age. And this is something that helps the skin. It can actually help prevent acne and things of that nature. We have rest and recovery, or active and recovery, for athletes who have been out and put their bodies through a real vigorous workout and put them to the max of what they need to be. And we have the, a vitamin infusion to help them recover a lot better than they normally would without injury. So we're adding things every day just to help people in a natural way, so that they can function and continue the course of their life healthily.
How much of that is education?
Almost all of it is education, and we have to start learning and educating ourselves on how to take care of ourselves. And as doctors, that's our job. That's what the first 2 letters in our title mean: teacher, doctor. It means to teach the patients and get out there and educate people, and that's why I'm glad to be here. It gives me that opportunity to educate others. People always are looking at different ways to take care of themselves, but most of our diseases are preventable, and that's why that 70% choice plays a role. We want people to start thinking about losing weight, exercising, doing the things, eating right, things that are designed to help them help themselves.
Wonderful. Well, great information. Love what you guys are doing there. We'll give everybody your information in case they would like to get in touch. It is Muncy Family Chiropractic and Sports Health Center. They're right there on Moore Street in Bristol. Check out their website as well for more information. Hey, speaking of healthy, when we come back, we got fruits and vegetables and lots of them. Stanley's Produce over there in our kitchen.